From the Centers for Disease Control and Prevention shows that more people died from suicide in the United States last year than any other year on record. And while those numbers slightly dropped in teens from the year prior, it is important for parents to have the tools to get their kids the help they need. And so this afternoon, we want to bring in Megan Graves, a licensed clinical social worker supervisor and clinical manager for Texas Health Behavioral Health. Thank you so much for being with us this afternoon, Megan. This is a topic that really should concern every one of us, especially those of us who have children. And I know that you teach a suicide prevention course known as QPR, or Question, Persuade, Refer. Tell us a little bit more about how that works.
Absolutely. So QPR is a program that was developed to educate just the kind of civil person, anyone in our communities, about how to look for signs of suicide and how to intervene in people's lives to help get them help before they get to the point of attempting to end their life.
Now, of course, you know, most parents will say, well, I don't think my kid would ever do this. And I'm sure that, you know, that's happened a lot with people whose kids actually have gone through with something like this. What are some of the signs that parents should be on the lookout for that show that a teenager might be suicidal?
So I think the first thing we really should look at is any changes in typical behavior. So for a teen who is normally very social, they may all of a sudden start isolating and withdrawing from their friends. Or you think about a student who's really good at school, all of a sudden their grades are slipping. Changes in their normal sleeping, eating, self-care patterns, and truly just looking too at anyone who has an increased risk of suicide would be somebody who's lost a relationship, had a breakup, recent deaths in the family, somebody who's having bullying going on at school, or anyone who falls into the LGBTQ category may also be at increased risk for suicide.
Okay, so Megan, let's say that a parent sees some of these signs or signals and they start to worry. Anyone who's had teenagers especially knows that, you know, how you broach a topic really, makes a difference in whether it's going to go anywhere, whether you're going to get any information back or make any progress with them. What is the best way to start the conversation if you start to notice things like this as a parent?
So my best advice is to be direct. Ask directly about suicide. Ask your teen, are you thinking about ending your life? I think we have this misunderstanding in our culture that says if you ask about suicide, it's going to put it into somebody's head, when really it's quite opposite. We're not going to make somebody suicidal if they aren't already. We can also ease into those conversations if it's hard to broach that topic, and maybe start with an easier question like, have you been unhappy lately? And if that answer is yes, then we say, have you been so unhappy that you've been thinking about ending your life? To try to ease into it, but don't shy away from using the word suicide. Don't shy away from asking the question.
I think that's a very important piece of advice, because I've actually heard from people who were afraid to ask that because they thought it was going to put something in someone's head. So thank you for clearing that up. Last thing for you here, how do you make sure, let's say that you want your child to go to a therapist, how do you make sure that that therapist is effective for teenagers and not just sort of, you know, checking the boxes with your child?
Absolutely. I think that's a great question. So, with any therapist, you have an opportunity to kind of do an interview, look at what their credentials are, how they're licensed through the state, and look at what their experience is with. Ask them specific questions about, have they worked with teenagers before, and have they worked with the kind of specific concerns that your teenager is bringing forth. And then, too, when you're working with that therapist, ask for parent meetings with that therapist on a routine basis. They're going to keep your child's confidentiality, but they're also going to share their progress with you, which I think is so important to be clued in on as a parent.
This is such an important topic. We could go on and on, but just what you've given us just in these past couple of minutes, I think, is just so valuable for so many families out there. Megan Graves with Texas Health Behavioral Health, thanks so much for being on here with us this morning, or this afternoon rather, to talk about this.
Thank you so much.